This is it, folks. It's time to take a stand and fight against COVID-19.
Officials in Nunavut say the situation is critical. Resources are stretched and the territory's healthcare system is reaching its limit.
If there's more cases, our ability to manage it is going to depend a lot on the size of the outbreak, the size of the community, and how much work is needed to get it under control.
The virus has now spread to 4 communities, and contact tracers are racing to catch up. Today, a 2-week lockdown began to try to avoid overwhelming Nunavut's small, isolated healthcare centers, ill-equipped to handle severe cases of COVID-19.
You need higher level care, like being intubated, being on a ventilator, being in ICU. Of course, you need to go south, and sometimes arranging for that to happen and that happening quickly can sometimes be a barrier, to getting the proper treatment on time.
So far, Nunavut has not asked for help from the federal government, but the health minister says they're in constant communication and federal help is available.
We don't want to have to go there, but if there was a need, in fact, for the military to come and give us support, that they would be able to go to that extent.
One person has been hospitalized in Winnipeg. They've since been discharged. The epicenter of the outbreak remains the hamlet of Arviat, but the spread to even smaller communities is concerning, places like Whale Cove. The mayor there is trying to keep people calm.
I'm trying to recommend that the community should not panic and not visit, or if they don't have any priorities, to stay home, and as of today, it's locked down.
Also trying to calm nerves, the healthcare workers in the Iqaluit, Nunavut's only hospital with just 35 beds. The city posted this image on social media, showing 2 paramedics in PPE with their pictures taped to their chests. Health officials say they won't know for several weeks if the lockdown has worked, but things are still likely to get worse before they get better. Jackie McKay, CBC News, Iqaluit.